Doctors of Reddit, what was your dumbest r/Iamverysmart patient experience? A related story from my friend, a gynecologic oncologist. Basically, a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments like coffee enemas and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. I'm a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal? No. I need you to move your head right. Hey doc, are these cavities being caused by the anaerobic pathology microbes? No. They are caused by you eating snacks all day and not brushing." This one happened to my ex-father-in-law, and it's funny, but it's not. He was a surgeon, very gentle, soft-spoken guy, and came out to tell them the biopsy results, to which they responded, "Praise Jesus, it's malignant." He had to explain that malignant meant bad. RN here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. Has admitted to the floor and gets 4th antibiotics. What? Had a young woman with recurring UTIs that began after a recent partner and with no STDs, went through the standard questions trying to figure out what could be causing them, and eventually found out she had been lubricating with jelly, not Kai jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. 70-year female tripped and fell 2 days ago. She came it with hip pain, but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative "No, you are wrong, just stop it." Med student here. On my pediatrics rotation, a mother refused vaccines for her kiddo after educating herself. When prompted as to what she was using as a source, she replied, "My own brain." Lovely. Patient inquiring about birth control was adamant she wanted an IED. I didn't treat this patient, but I was on shift when this guy came in with tombstones on his EKG in the setting of chest pain. He told the ed doc, "I want a second opinion before going to the cath lab. This EKG is unmistakable." The interventionalist had to come down to the emergency department to tell him he was having a heart attack. Was working at a pediatric urgent care. Family brings in their 3-year-old unvaccinated son with autism for a weird rash. They couldn't give me any reason why when I asked them about his vaccination status. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a DNC, so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, "We don't know why you have these constant high levels of HCG in your blood and we are worried." Said it before, I'll say it again. Had a patient insist I didn't have a heart attack, I had a myocardial infarction. That's just the technical term for a heart attack. Genius. Anytime a patient comes in who is deathly ill and clearly needs antibiotic/cholesterol/blood pressure/etc. meds to get better that tell me I'm not taking the medicine. I know you just prescribe those because the drug companies pay you. Yes, sir/lady. All of these drug companies are giving me dollar bills y'all to put you on an antibiotic/cholesterol/blood pressure medicine etc. Right. Not an MD, I'm an RN that works with oncology, cancer, patients, some of which are on clinical trials. I got a patient and, before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. Normal range is usually between 70 to 100. He got really upset at this point and asked him what's wrong. Your labs are within range. And he said I needed to be 0. I said, what? Why would you want your glucose to be 0? He said he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, I don't know what clinical trial you're trying to get into, but if your blood glucose was 0, you'll be dead or dying. He was not convinced, because I'm just a nurse, so I sent a message to his MD asking them to educate their patients better. So, the patient had low blood pressure, so their self-treatment, eating more fatty foods, in order to decrease the size of their blood vessels, in order to increase the blood pressure within their system. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32 ounces soda every day. I ask her if it's regular or diet, and she replies with it's half regular. I'll let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children, thinks it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart attack. My favorite ever story from a colleague, a patient comes into R&D with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson, he lives up there." I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was Sevin powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. A friend of mine is on her last year of her medicine career. She told us about a group of women they received, a very low social position, had gotten pregnant, and wanted to abort. Bear in mind this is not the US, there are no abortion laws here. Well, they somehow heard of this method where you make a paste out of smashed parsley and put it in your vajayjay to abort. As it turns out it actually works, but because parsley has this enzyme, forgot the name, I think the substance is of sorrelin's family, that mixed with other stuff causes severe cellular death and necrosis. Some died out of a necrotic who has some turned into a real life Barbie, and not in a good way. I had a patient who was a completely non-compliant diabetic, smoker, morbidly, who had his first heart attack at 45. His blood pressure was also super high, and instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. During my rotation at pediatrics we had an unconscious 16-year-old male with a prior history of type 2 diabetes. The mother had come home from work and found him acting strange with slurred speech and stumbling around, so she immediately drove him to the hospital where he passed out in the car. Running the full rainbow for blood draws and tests, the kid had a blood glucose of 285 and a BAC of 0.11. Near as we can guess, the kid was drinking after school while his parents were away, got too drunk, didn't know that alcohol turns into sugar, and wound up drunk and unconscious from both the alcohol and the lack of insulin.